You know, boys, drop that muffin. Come on now. You know, you have to eat protein in the morning. Drop that muffin. You know, I invite you into my office. You know, I'm trying to teach you stuff, trying to make your bodies great. And here you're sitting here at 7:30 in the morning eating a muffin. You know, and I saw you exiting out of that pizza place last night with 4 pies. Come on now. I mean, you know something, you want to get a body, you want to look great. Stop that muffin, stop that pizza, stop that beer. Eat protein. You know, listen to your boy John here. What we got here is a gentleman. He's 60 years old and he looks pretty great. This is one reason why I don't listen to my patients who say, oh doc, but I just want a 6-pack. I just want a 6-pack. You know, it's not what I do. I do what is great and what is best. He, in the 90s, went to a doctor and he wanted a 6-pack. Maybe it was your fault, maybe it was the patient's fault, maybe you asked him for a 6-pack, maybe you didn't know, and the doctor listened to you. But look how strange it looks. He's got a great 6-pack here, a little too great. And I'll explain to you in a second why it's not really amazing. But the doctor didn't do anything here. He actually had gynecomastia surgery. I'm covering the nipples because Instagram hates nipples. But the glands are gone. But look at this. The doctor didn't do anything artistic here. He's got this side boob. So he's got this chest that looks like a 50, 60-year-old chest. And he's got this lower body that looks a lot younger, but fake. It looks a little too much for his age. He did a 6-pack here, but I can't even see where the 6-pack is. He looks like he's got the first one here. He's got like a 2-pack with the lines, a little too much etched, but didn't start up here. And he's not a tall guy. He's, what are you, 5'5", 5'6", 5'7", 5'8". He's like me. You know, maybe you were. Maybe you're shrinking a little bit. I'm shrinking. But this 6-pack should have started up here, sucking your belly. You know, that 6-pack should have started up here, the first one, the second one, and the third one. So I'm gonna etch this a little bit on the top and smoothen out the bottom one. He thinks this is a little too much. The semilunaris is great. I mean, I don't have to go down here much. I may go down, you know, here, because as we get older, we shorten up, and you got this, you know, use a little lipo, a little Renuvion here to tighten that up on his hip. But, you know, as we age, we shrink, like an accordion. So we get like fat and wider instead of tall and leaner. That's the nature. Our spines shrink. Am I right? Good. Thumbs up. So all under local anesthesia, comfortable and perfect. Again, drop that muffin and let's go. We pump you up.
Pump you up.
All right, boys, so here, you know, Lebo's got your back. Lebo's got your back. So we're now, with this ultrasound technology, it is melting. This is perfect for scar tissue, and that's what he's got. He's got scar tissue, but thankfully it was many years ago, 25 years ago. So this is doing its job, and it's going through here like butter. So here now I'm going down to the lats. Feel anything? I've marked. My markings are important, and we're going to keep on marking. So it's about definition here, but good definition, not fake definition. So So here, I'm gonna do the same thing. Get underneath the nipple, free it up a little bit. Glands are pretty much gone, but once we lipo, I'll discover that better. All right, so here I am, going that little midline there, and going around. Again, he wants this belly to be flatter and get the abnormal inscriptions less aggressive, less in your face. All right, so here we are on this side. Again, the semilunaris was a little too much. So I'm freeing it up, freeing the scar tissue away from it, releasing it, and then I'm going laterally to the hip. That's my hip here. And I'm going down to kind of give them a less dramatic look. As guys get older, they become shorter, like an accordion, shorter and wider, and you get that kind of belly look. We're at the belly button, okay? All my incisions are stealth, okay? So I want to get this a little bit better. And this is the beauty of touch-ups. Ultrasound technology is going to break up all this terrible scar tissue. Okay guys, so I did the Vaser, melted everything, got rid of the irregularities, and etched some areas, the muscles, specifically the pecs and the lats. And here we go with the Liposuction. This is a 4mm Mercedes long into my stealth incisions with the ports protecting. And let's make it happen. There you go. So we're going to concentrate first over here because he's got no glands. They were removed, 25 years ago. But he had no definition of the lateral pecs and the lats. And that's what he really wants. And then we're going to go to the belly and kind of smoothen out the harshness of the six-pack. All right, so here, I want to get way up here. A little bit better definition in the center here. So now I've turned them around. I want to get around here. Open that elbow. If you're move your hand a little bit there. Just want to get around the side here, and again, get this nice lat definition right here. And we'll stop at a liter. So now we're going to get another liter out of this side. So here we are with my curved cannulas. Give it some shape, but go easy. You all right down here? Yep. Just gently, nothing terrible. In the correct spot. So Renuvion powered by J Plasma, right here. We're gonna tighten this all up nicely. This is helium gas with a fire, a radio frequency spark at the end. It ignites. And this is heat, and it tightens up the skin, shrink wrap. So this averts any kind of skin excision or a nipple lift or whatever you wanna say. You do about 5 passes, nicely and gently. Almost done, yeah.
You're at 0.9, 3.9. And full.
Alrighty, so this is the fat grafting, okay? So I go into the same stealth incision and go into the muscle. So this is in the muscle or under the muscle, above the rib cage. He's already numb from my local. I can see where the tip is, and just give him some nice, beautiful filling. He doesn't want to be outrageous because he's a mature guy, if I can call him that. Maybe he's not so mature, but he's somewhat mature. Good. Dr. Lebowitz, Long Island Gynecomastia Center, Long Island, New York. A revisional case, a young man from New Jersey. Young man, younger than me, but he's kissing 60, and he wanted to be fit. He wanted to be, you know, the bomb. He wanted to be fire. He wanted to be sexy. You know, why the fuck not? You know, if you want to do it, especially in this pandemic, in this environment, political, economical, you know, go for yourself. You know, don't go on those vacations. You want to go on vacations anyway, you know, with wearing a mask. And eating out is a chore anyway. Spend the money on yourself and be good to yourself and be good to others. And that's the name of the game. We did Vaser, high definition, power assisted liposculpture. Gland was gone, so we didn't have to remove the gland. We kind of did the focus on the chest and the lateral chest, the pecs and the lats. And he had the 6-pack but it was wrong. It was like a 2-pack. It was too low and it was too, you know, dynamic. So we kind of smoothened and evened that out, appropriate and natural for his age. We did LipoFilling of his chest piece. We really had to lift up and get that chest upper volume perfect to match, you know, everything else. We did Grafting. We did J Plasma, Renuvion, powered by J Plasma to tighten everything up. He is going to look absolutely amazing. So in this environment, take care of yourself, take care of others, and you know, if you need me because of your gynecomastia issues, either primary or secondary, like this gentleman, you call me 631-424-0101 or email me at jonathanleibowitzmd@gmail.com. And remember, at the beginning of this video, stop with the freaking, you know, muffins and the bagels and the cream cheese, you know, and the pizza. You know, eat protein, less carbs, exercise, be good to yourself, be good to others, and that's the name of the game. 631-424-0101 or email me at jonathanleibowitzmd@gmail.com. You know, guys, you know, boys, I got your back. Thanks, I got your chest. Thanks, and see you soon.